when I was about 10 or 12 years old. I wanted to be a veterinarian. And I worked for a veterinarian when I was 15, 16, and through high school, and then went to Auburn University for 7 years to become a veterinarian. Moved up here in 1980, opened up this clinic. I'd like to talk to you today about emotional problems that a lot of dogs or cats may have from time to time. People a lot of times will see their pet sitting next to them watching TV, and then all of a sudden they jump up and run off like they've been shot by a gun. A lot of times that's fortunately fairly simple ones. Those are usually flea bites. Fleas can be irritating, cause them to be sensitive on their back, usually right over the base of the tail. So if you see hair loss in that area, and especially if you see fleas, work on flea control, and that'll help out tremendously there. Other things that we see from time to time are phobias associated with things like thunderstorms. Thunderstorms can be a real problem for some animals. They become intensely nervous, and the problem is you may not even know the storm's approaching because the dog's hearing is so much better. A lot of times they'll hear those vibrations that are coming in from faraway thunder that you can't hear. And they become very sensitive, they become anxious and running around. So if you have a thunder shirt, those seem to work well. So maybe pick one of those up and keep it around in case he's having a problem. Other things that can come on is phobias associated with different people. Some dogs don't like men, and some dogs don't like women. And there's some different training you can do, try to break that down, make them feel a little bit more at ease. Try to get different people to take them for walks and things like that and reward them. Most dogs and cats are food driven, so if you get a person, say they don't like a certain person, and you get them to help feed that dog, a lot of times they will calm down. So we recommend some of those different things along those lines. In this area, we do have a doggy psychologist if that's necessary. Dr. Strickler is in the area, and if we need to, we can always refer to her. She sees animals, and she can really diagnose some of the different cases of what's going on. Other diseases such as anxiety, separation anxiety, can be ameliorated through behavior therapy, obedience training, and if necessary, medication such as clomicalm. Some things you have to go through desensitization. Like say your dog was sensitive to thunder, what you might do is get a CD of thunderstorms, recording of thunderstorms, like for people like white noise. Put it on real low on a regular basis, or even just 24 hours a day for a while, on a low level so that your dog can hear it, but that it's not really bothering you. And let him get used to it so that it's not a problem. Other things dogs have sometimes are car sickness. And you put them in the car, and as soon as you get out of the driveway, they're throwing up in the back seat. That's always a lot of fun. What we recommend there is just get in the car with your dog or pet them right there in the front seat, then get back out. Say, hey, the dog doesn't understand, gets in, gets out, nothing happens. Reward him when you get out, give him a treat, let him run around. Then as that settles down and there's no problem there, then back up to the end of the driveway. Then get out, let the dog get used to it. This is called a process of acclimation where you gradually get them used to it. You may even have to drive around the block one time, then go back home. Just drive around the block one time, go back home. And then maybe 2 blocks, maybe then all the way to the park and back. Pretty quickly, that dog will realize that the end of the world isn't going to happen because you pulled out of the driveway, and he'll calm down, make a better traveling pet, won't get under your feet while you're driving or distract you and cause an accident, and make it safer for him and you.